Okay, again, this is the National Expansion Webinar, Exploring AIM-CCI. So this is really a presentation we've put together for those who may be interested in bringing Alliance for Innovation on Maternal Health, the Community Care Initiative, to your community. So without further ado, we'll get started. My name is Karen Schutz, and I am the Senior Program Manager for AIM-CCI, the National Healthy Start Association. With me are my colleagues today on this phone, our incredible AIM-CCI team, whom I will introduce momentarily, but you're going to be stuck hearing my voice for the majority of this presentation. So I'm going to facilitate this today, and then again, we're going to have a Q&A toward the end. Okay, yes, Zoom was cooperating earlier. So again, the idea today is just to give you some background information on the AIM-CCI approach, describing the program and our approach to maternal safety and wellness in the community setting, which is based on a collective impact model that we'll talk about a little bit, and also describing examples of our maternal safety bundles and the pilot initiative that we have been piloting and testing our bundles and this approach with. And then also looking at the application a little bit and describing the next steps in this plan for national expansion. So again, I'm Karen Schutz, the Senior Program Manager, and on the screen here you have our incredible national team at AIM-CCI, led by Deborah Frazier, who is the CEO of National Healthy Start Association, is our PI, and our co-PI is Dr. Haywood Brown. Dr. Sani Sully, who is going to join us a little bit later in the presentation, is our data manager. And we have on the line with us today, Dr. Ashley Calderon, our clinical implementation manager, Dr. Liddy Vess-Sawyer, who is our equity implementation strategist, Dr. Valerie Newsom Garcia is our community transformation strategist, Alicia Roche is our communications director, and the incredible Amber Wilson is our program coordinator. In addition to the staff at National Healthy Start, we also work with an esteemed group of consultants that work very closely with us day in and day out to develop this initiative, including Sue Kindig, Deidre McDaniel, Dr. Fleeta Mask-Jackson, Dr. Joya Creer, and Dr. Derek Griffith. Dr. Creer Perry and Dr. Griffith work with us on the focus group evaluations, and Sue, Deidre, and Dr. Jackson are our consultants on bundle development and implementation, and they're just incredible. In addition to our team at National Healthy Start Association and our consultants, we also work with an esteemed group of professionals across the spectrum of maternal and child health that serve as our National Maternal Safety Committee. And they are very numerous to mention, but we enjoy their guidance and support on this project. Okay, let me get my Zoom to work. So just kind of first things, some level setting here. What is AIM-CCI? So Alliance for Innovation on Maternal Health Community Care Initiative. This is a one-of-its-kind pilot that was funded in 2019 to the National Healthy Start Association, and we entered into a cooperative agreement with HRSA to develop this pilot program with two main purposes: to support the development and implementation of non-hospital focused maternal safety bundles within community-based organizations, and then also to build on the foundational work of AIM, which is the original AIM program that is operated by ACOG to address preventable maternal morbidity and mortality in pregnant and postpartum women outside of hospitals and birthing facilities. So you'll see that repeated over and over: non-hospital, outside of that hospital and birthing facility setting, thus the community approach, which is what makes this project so different. And so why was that necessary? Why did HRSA decide to go outside of the hospital to focus on maternal health and safety and wellness, it's because the majority of maternal mortality happens during pregnancy and postpartum and not at the time of delivery. So recognizing that, HRSA saw the need to expand care beyond hospital-focused safety bundles. And that's how AIM CCI was developed. So this is our process. And so National Healthy Start, in thinking about how to tackle this really complex issue across the community, what was that process going to be? Because maternal mortality is a very complex issue. And so we developed this standard, this process in an attempt to standardize care and services across a wide array of different community providers, beginning with equity. And we've developed an equity framework that really, this work is centered around, and we like to say it's inculcated throughout the work. We include the community. We bring in community providers, and then we factor in the social determinants of health. And of course, all of this is driven by the data. What is the data showing us? We identify those benchmarks and metrics and measures so that we can really see how this approach is contributing to improved outcomes. So beginning with equity, and again, we say it's a beginning, but really equity is woven throughout this process. And we say it's inculcated into these 5 domains across the spectrum, from diversity, inclusivity, belonging, racial equity, respectful and equitable care, and community integration. So a main goal of AIM CCI is that all women and birthing persons have access to a community of care that is truly equitable. So racial identity holds no influence on maternal health outcomes, and where communities have an established standard of care approach across the United States that guarantees optimal health outcomes to all women and birthing persons. So, the factors of race, should not play into outcomes when we're dealing with women across the spectrum. And I have lost my button. Hold on one second to move us. Okay. So why is maternal health equity important? I think that this graphic this is stats from the CDC, shows that, regardless of the evidence-based approaches that we have used in dealing with maternal health, we still see these tremendous disparities across race. When you look at the rate of maternal deaths by race, and you see that non-Hispanic Blacks are at 55.3%. That is still an incredible disparity. And so that's why equity is important in this work. So we really, in thinking about this, have to, are seeking to create an approach that is addressing the structural issues that are contributing to these disparities. So when we're talking about racism, and how it impacts service delivery and ultimately these outcomes, that's what we really want to get at. We want to change that. We want to shift that paradigm, that this is not going to have, the consequences that we're seeing now. Oops, I got ahead of myself. So how do we do that? How are we inculcating equity? One of the first things that we developed with AIM CCI was called the SAMRAC. It's the Self-Assessed Measure of Racial Equity Capacity. And that was developed by Dr. Vijaya Hogan and our equity work group at AIM CCI from our National Maternal Safety Committee. From the SAMRAC, we then developed what we call the Racial Equity Learning Series. which was developed by Dr. Terry Wright, also with contributions from Dr. Marsha Broussard. And then our team here at AIM CCI took that content and made it into an online learning series under the guidance of Dr. Lidives Sawyer, who's on our team. And so the Racial Equity Learning Series, or as we call it, RELS, is a 7-part module that's designed to enhance knowledge on equity capacity. And it goes across the spectrum from an individual's own personal view and lens of equity and racial equity, all the way through teams and departments to a systems level. And really the main objective is an understanding of the role of racism and how it contributes to these outcomes. So RELS it's a resource that we've developed. It's in the public domain. It's absolutely free. It's at no cost. And it has 10 CEs that are accredited by the American Public Health Association. And so RELS has become a foundational piece of our AIM CCI model. So when we started to develop the maternal safety bundles that we'll talk about in just a bit, RELS is included, the SAMRAC and RELS is included as a foundational piece of every maternal safety bundle that AIM CCI develops, because we believe that strongly that communities that really come together to do this work have to first assess and have a baseline of what their capacity is to address this in the context of racial equity. So that's how we began. We began with equity, which is inculcated throughout these processes. And then, of course, this is a community-based and a community-centered initiative. And so we have to bring in the community voice. And how we do that has been with the consultants that I mentioned earlier from National Birth Equity Collaborative and Georgetown University, Dr. Griffith. And we have asked them to do focus groups with participants of our pilot sites. So we have 6 pilot sites across the nation working with us right now. From those teams, they recruit participants that are in their respective organizations to take part in focus groups. And so far, we've done 2 focus groups at each of our pilot sites for women and birthing persons, and also for fathers. So we want to capture the voice of fathers in this process as well, because we know that that support is so critical to good outcomes. So we went the route of focus groups because we want that community perspective and insight into the factors that are really influencing behavior. And we want to center this knowledge through the voice of those participants. And so I'm not going to read these quotes, but we have started to receive some preliminary analysis of the focus group data, both from National Birth Equity Collaborative and Dr. Griffith's team at Georgetown. Again, this PowerPoint will be available in the recording and can be shared with everyone. So these were just a couple of examples of what MBEC heard from the women that they spoke to in some of the focus groups. And we're also going to be conducting focus groups in year 4, again, through our pilot site partners. Dr. Griffith, when completing the focus groups that we called Focus on Fathers, identified several themes that have emerged from working with the fathers, really about their feeling of, being a part of the process, their voice, resources, engagement. So it's yielding some incredible insight that we hope to continue to build upon as we develop further this project and our bundles. So that's how we include the community voice. So again, dealing with or taking on the challenge of trying to improve maternal health outcomes, looking at severe maternal morbidity and maternal mortality in a community setting is an incredibly complex challenge. And so in thinking about the way to do that across a spectrum of various community providers, National Healthy Start Association proposed a collective impact approach. And so this slide just is a depiction of an overview of what collective impact is at its essence. You bring together the community around a common agenda with shared measures, mutually reinforcing activities. And in this case for AIM-CCI, that would be implementation of the maternal safety bundles, continuous communication, and that one maybe should be highlighted somehow because it really is a process that involves engagement and continuous communication, really to break down, as we like to say and remind our partners, you know, a real goal of this is really to break down the silos, right? For people to reimagine how they can work differently in the space. And this is all really driven by backbone support organizations. So when we talk about the application and our approach and our process, you'll hear us refer to the term local maternal safety work group. And for all of those collective work groups, we have one lead organization that we work with. And when you put forth an application to become an AIM-CCI site, we're going to look for you to identify that lead organization, because that's going to be the entity, the one entity that we will contract with and that we will work with, you know, as our main point of contact to help support implementation in your community. So we're bringing the community together to address this very complex issue using a collective impact approach. And for AIM-CCI, that looks like this. So this is our conceptual model of our collective impact approach. And so you see that equity drives it all. So it is all centered in equity. And I'm just going to kind of take you through this a little bit by color code. We like color coding. So by color coding here. So at the center of this graphic is the maternal safety bundle. So once you have a bundle, you want to address maternal morbidity and mortality in your community, and you're going to implement the AIM-CCI community care bundles. So in order to do that bundle implementation, you're going to have that group that's depicted in the tan color, which is all going to be all of those organizations that can contribute to implementation. They're going to be some type of service organization that is a touch point for a pregnant or postpartum woman or birthing person. So those are going to be outpatient providers, maybe early Head Start, WIC, the local health department, Healthy Start, FQHCs. These are people that provide those kind of direct services, and they're going to be able to contribute to data for your efforts in that community. So data sharing is a big piece of this model. There are also those members in your community that may be advisory to you. So those are the ones that you'll see depicted in orange. So they may be community residents, other maternal and child health advocates and membership groups, local hospitals, the state Department of Health, your Title V and MCH programs. So they may not necessarily be providing direct services to women and birthing persons in your community, but they certainly have a vested interest and can be a great champion or advisor for you. And then there's that broader community, you know, even broader. You have policymakers, you have payers, you have Medicaid, you have health journalists, right? You want to create a buzz around this and why this is a critical need in your community and why your community has sought to bring this project to fruition. So our core philosophy really is that by elevating the voice and wisdom of the community, we can close the gap between what care birthing persons need and what the clinical system offers. So we really want to change that system design and how these services are being delivered and thought about. And I was just going to show, this is actually a slide from our partners in New Orleans, and they did a presentation for us, and this is how they conceptualized bringing their community together around the AIM CCI bundles. And so they have community leaders, they have local, state, and national public health agencies, healthcare professionals, researchers, consultants, advocates, and residents. And so this was just how they depicted it for their local maternal safety work group, their visualization. Okay, so now we're going to factor in this process, we're going to factor in social determinants of health. And, you know, I refer all the time back to my early days in social work. I used to think about this as a web, like all of these really intertwined pieces of a person's life that, you know, are just so tightly woven. And today we call those social determinants, you know, the conditions and the places where people live, learn, work, play, that affect a wide range of health and quality of life risk and outcomes. And we know that social determinants are driven by, you know, can be driven by and impacted by a system of racism. And so we really want to develop this system of care so that not only are our providers thinking about clinical outcomes, but how are those clinical outcomes being affected by housing, you know, by these other social determinants that have a really, you know, important impact on someone's optimal outcomes, or how they can optimize, you know, their own health. So the clinical community integration, we developed this, and it's posted on our website. In the application packet and any information that you've received about applying to become an AIM CCI partner, we reference this clinical community integration kind of as a pathway to think about how you will bring your community together. And there is specific information, and it's called out specifically around considering social determinants, and how do you factor that in when you're thinking about how your community makes referrals, how resources are aligned. You know, are you using tools that can capture a person's need relative to those social determinant factors, like housing, substance use, food insecurity? Was that the, yeah. So who is testing AIM CCI? Again, this is a pilot initiative. We began in 2019 officially, and it's a 5-year pilot effort that goes through 2024. We work with incredible partners across the country, and they're noted here, well, actually on the next slide. But each local maternal safety work group is comprised of a diverse group of community providers, both clinical and non-clinical. Again, they're working collaboratively in that collective impact framework, and they're looking at this issue, you know, from a systems level and a community focus to standardize care across the continuum, across those sometimes siloed, you know, services that are all working toward the same thing, are all working with the same participants. So we are very fortunate to work with incredible groups in Fresno, California, Grand Rapids, Michigan. We're in Tulsa, Oklahoma, New Orleans, Louisiana, Atlanta, Georgia, and Newark, New Jersey. And again, in the application itself, there's a link to our website that shares more about our partners in the pilot initiative. And so our pilot partners actually work with us to not only test the elements, what we call the elements, are these recommendations that we put forth in our community care bundles, but they also help us to actually develop those bundles. So it's a really incredible process to work with them because they have visibility on kind of the why behind the bundle, like how it was developed, what we were thinking. They participate in that process very closely with us. And then they get to see how it lands in their community on the ground. And then they give us that feedback. So it's been an incredible process to work with them. And if any are on the line today, I just want to thank them again for their partnership. So bundles, we talk a lot about bundles. And for those on the call who may not be familiar with the term, a patient bundle or a maternal safety bundle really is just a small set of evidence-based interventions that combines medical and improvement science to achieve improved outcomes. So it's born out of that QI process. How can we look at what we're doing and look at the data and then find ways that when done, you know, with evidence can make a difference, can help us to improve those outcomes. So in the AIM-CCI community-based approach, the teams and delivery system implementing bundles go beyond just a hospital, right? So in hospital QI, you may have different departments coming together to implement a safety bundle within the hospital. So they look at their different protocols across the departments and how can they work together to implement, you know, this evidence-based intervention. In the community setting, you're actually working across, we're working across different organizations. So not just different departments, but we're working across different organizations. So it goes beyond the hospital walls and beyond just one organization. It encompasses the collective across a very diverse sector of different service providers to achieve this impact, because not one entity can do it alone. So I've been talking a bit, so I'm going to take a break. And I mentioned earlier that our esteemed team is on the call today. And so you'll hear from some of them. And we thought that this was a really good way to give you all some insight, not only, you know, on who our team is, but on our processes of how we developed bundles, how we think about this work, why we're committed to it, who the people are behind AIM-CCI. And so on our website, when you go to look at our community care bundles, you'll see each bundle has a little, what we call a roundtable video that gives you insight into the why behind that bundle. What made us think about putting together a postpartum bundle or a maternal mental health bundle. But this is an introductory video really that talks about our process, why doing this in community is important. And you'll get to meet some of my esteemed colleagues from the AIM-CCI national team and our consultants in this short clip. So I'm going to play this, and if my Zoom luck is working, it will be seamless.
So welcome and thank you for joining us today. My name is Ashley Calderon. I am the Clinical Implementation Manager for the AIM-CCI project. We are here in Anacostia at the Family Arts Museum for a roundtable to discuss the AIM-CCI project, the Community Care Initiative, and talk today about bundle development and what makes our process unique and innovative. I am a nurse. I worked in maternal child health care for my entire career, and I really came to this work because I believe that when you walk into someone's life and have the opportunity to provide care to them, it really is a privilege. You don't know what they are bringing to the table with their experiences, and likewise, you're bringing your own lived experiences in there. And you have that opportunity to gain their trust and to make a difference in their life. And I hope that AIM-CCI can bridge those gaps and encourage people to first look within themselves and then look at the system to see how they can make a change in their own community. So we can start by going around and telling about how the work that we do with AIM-CCI. Deidre?
Hi, I'm Deidre McDaniel. I'm a maternal child health social worker, and I'm also the clinical community bundle integration specialist here at CCI. The reason why I'm working on this project and what brought me
I am so
to this
sorry.
work in general is because I have a deep desire to make an impact in the disparities in maternal health outcomes for African American women. Sonny?
Sure, thank you. Hi, my name is Sani Soli. I'm the data manager for the MCCI program. My role involves supporting the team in gathering data and evidence to support bundle implementation and even bundle development. The reason why I'm here is because of my interest in understanding maternal child health, but also researching and being able to support the development of measures and metrics in bundle implementation or even improving general outcomes for mothers and birthing persons across the country. I'll pass it on to Sue. Thank you.
Hi, I'm Sue Kendig. I'm a women's health nurse practitioner and attorney and work with the AIM Community Care Initiative as a clinical community integration and patient safety strategist. I've worked in maternal and child health and community health for my entire career, and this project brings together both of those spheres perfectly in the hopes that we can truly make a difference in improving outcomes for families and to eliminate the disparities in maternal health outcomes. And I'm going to ask Liddy Bez to introduce herself.
Thank you, Sue. Hi, my name is Liddy Sawyer, and I'm the Equity Implementation Strategist. What brings me to this work is both my personal and professional experience. Professionally, my work has always been grounded in equity. It has been an evolution to be in this space of maternal child health, and I hope that the work that I do within this space allows us to instill and inculcate equity.
All right, so now that we've talked about who we are and why we're here, I guess we need to do a little bit of background and just talk about first, what is a bundle? So Sue, would you like to get us started with the conversation and discuss what a bundle actually is?
Sure. A bundle is simply a small set of evidence-based elements that, when they are performed consistently, help to improve outcomes. And in maternal and child health and obstetric care, we're used to seeing bundles in the hospital setting. So, for example, what do we do if a woman is hemorrhaging during labor and delivery? By implementing a small set of steps consistently, people can find the medications that they need. They can act quickly in that situation to help save lives. The thing that's interesting about AIM-CCI and what I think is really exciting is we are moving that process into the community. And by moving it into the community, we need to understand what is happening in communities that are placing the lives of birthing persons at risk. And we need to go to the community to really help to understand that and understand the realities of their lives and what is driving some of the risk factors. So one of the things AIM-CCI did was a survey of sites that are working with us to help figure out what some of those root causes in the community might be that we can address through bundles in AIM-CCI. And Sani, I think you were working on the survey. Can you talk us through some of the things we found from the survey?
Yes. So part of what we did with MCCI was conduct a survey with all of our constituents, both individuals within the local maternal safety work group as well as the national maternal safety work group. Committee, I'm sorry. And part of that process involved obtaining qualitative and quantitative data. And we juxtaposed that same data with the publications that are provided by the CDC or even other researchers across the country. And that information aided us in tailoring and understanding what the communities needed and how we can be able to create bundles that are actionable in real time, and also that we can be able to obtain data that can be able to inform some of the work, both in the short, intermediate, and long term. So it is definitely a continuous process of learning. Now, these evidence that we compile from researchers and even publications have aided us in creating a set of recommendations that we continuously review, we continuously evaluate. And as we move along, we are learning a lot from what the community needs versus what we thought they needed in the initial process. So it's definitely a continuous process, and we continue to learn from these processes.
So it definitely sounds like it's a collaborative effort in terms of pairing the evidence and what we're seeing in the data and the literature and what's going on in the outcomes, but also infusing the information that we're receiving from the community to make sure that we're addressing the needs, we're addressing what the data has, and it is evidence-based, but it's also participatory from the community aspect.
Absolutely. So the data we obtain, or even the measures that we develop, go directly back to the communities, and the communities aids in understanding what is plausible, what is feasible, what is even collectible, and that aids us in, I think, understanding where we go next. Hopefully, in next bundle development as we move along the program.
So there you have it, straight from our incredible team. And my apologies for, oh wait. I was trying to read the chat as that was starting, so my apologies for the disruption in the video, but that was just a little video, and I hope that it gives you a little bit more insight into how we approach the work, why it's important to all of us, and you know, why it's so important to, again, as HRSA had the foresight to see based on the data, to take this outside of just the clinical and hospital walls, that this really is a very complex issue that requires different sectors of the community to come together to create solutions. So Sue, I think, explained beautifully what the safety bundle is. And at AIM CCI, our bundles are community care bundles. So you'll see that each will start with that. So it's community care. The very first that we published and made available in September is the community care for postpartum safety and wellness, which is available right now on our website. And in each of the bundles, and you'll see this if you explore the website and go to the bundles page for the postpartum safety and wellness, it really takes a look at foundational actions, patient level actions, provider level actions, so that you see these elements or these recommendations, we call them elements of the bundle, are kind of broken up into those, you know, those kind of those buckets, if you will, foundational, patient, or provider. And so across all of the bundles, though, as I mentioned earlier, we have the foundational that are specific to AIM CCI. And so that includes the assessment with the SAMRAC and RELS, and how you look at your, you know, community referral processes. And so you'll see that across all of our bundles, and it's exemplified if you go now to the website and you can look at it in the postpartum bundle. So I mentioned earlier that our pilot sites have been incredible partners working with us on bundle development, as well as testing the bundle elements in their communities. Right now, they are testing or wrapping up the PDSA cycle on maternal mental health and wellness. So that bundle will be available in early 2023, and it looks specifically at stress, anxiety, and depression. So it's still being tested right now as an implementation partner. So as we do this national expansion and new communities come online with us, you will not be testing per se. So these bundles will have been tested by our pilot sites. We've collected their feedback, we're collecting their data. And then you can, you know, pull them down offline, start to work with your LMSW and your community around implementing these elements. But as you give us feedback, as you give us your data, that definitely will also continue to inform this process. And I think Dr. Sully said it very well in the video that we just saw. This is all about learning, right? We need to learn what works in community, what works across community. And so even though we're taking it out of the official testing phase with our pilot partners, your input as you work through these bundles in your community is critically important as well. So this one will be available in early 2023, and we'll talk a little bit later about additional resources. With each bundle comes resources, be it templates or tools that you can use to implement, scholarly articles and research that helps you understand more about that particular subject area, etc. And then under development, we are concurrently, as we are testing bundles, developing new bundles, we have just finalized today, actually, 2 bundles. So we have developed the interpersonal violence bundle that will then go to our pilot sites for testing. And, this was a really important, but all of them are important, but this one is unique, I should say. Just in recognizing that intimate partner violence is a major contributor to maternal mortality, even though it's not always grouped in those disease states that we think about when we talk about maternal morbidity and mortality. And so recognizing, again, driven by the data and what we're seeing happen in communities, we really thought it important to take on this topic. So we have intimate partner violence that will be begin to be tested soon. And then for chronic conditions, we have actually developed 2 new bundles around chronic conditions, one that will be focused on the prenatal and pregnancy phase, and then the other on postpartum. So very excited to get those to our pilot sites for testing very soon. I'll just talk quickly because I'm trying to be cognizant of time, and I want to give Dr. Sully ample time to talk about our data processes. But in addition to the bundles, we also have, we are continuing to create additional resources. So we talked earlier about the Racial Equity Learning Series, which is an online course with 7 modules that you can pick up free of charge. In addition to RELS, we also have a user guide for managers working with teams. And so this helps to facilitate having a team complete RELS together, and then opportunities to talk about that and discuss it in how you can then take that information to look at your own systems in your departments across your team. So we have the Racial Equity Learning Series along with the Leadership User Guide for RELS. We've also developed Maternal Monologues Toolkit. And this was born kind of organically out of conversations with our team. And what the intent is really to have communities have the tools to harness the power of their own stories. So this is happening in communities across our nation. We know that. So sometimes we just need to elevate those stories and to be able to tell our own stories so that we can start to advocate for change. And so the Maternal Monologues Toolkit is that. It's a guide to help communities have conversations and steps to take those conversations into action. We also have other learning series that are coming online. We have Planning for Pregnancy and Beyond, which is an online course. I think it offers 8 CEs that also supports our postpartum bundle as well as the chronic conditions bundle. When we publish the maternal mental health bundle, we will also have a module that complements that bundle that is an accredited module by American Public Health Association on the maternal mental health bundle. So I am going to now ask my esteemed colleague, Dr. Sani Sully, to talk to us a little bit about the evaluation and the data approach. So Sani, I'll turn it over to you.
Sure. Thank you very much, Karen. Good afternoon, everyone. My name is Sani Sully. And today I'll be providing you a brief overview of how we approach evaluation or how we think of evaluation in the MCCI program. Now, we do our possible best to take a holistic approach, meaning we try to understand your own environment and your own dynamics, but not just understanding. And again, this will work with the communities because we don't know your community more than you do. And in this model here that you're seeing is the Denobedian theory or the Denobedian approach in 1988. Now, one of the things that you see here is we take the process, structure, and outcome measure approach. Now, with the understanding that this is not holistic, it will not address each and every one of the aspects of evaluation or even each and every aspect of implementation. Therefore, I would like to just go through each and every one of these structures and show you how we approach it. And of course, how we inculcate theories or approaches such as 7-step 7 tools within our evaluation strategies. So with the structure measures, for example, based on bundle implementation, we are hoping to be able to understand the changes that you are making, the changes that communities are making, and how they are adapting to best practices to ensure that mothers and birthing persons receive care based on the most up-to-date guidelines. Now, again, guidelines being based on the bundle resources and measures that have been developed that are associated with the bundle. Now, we do not take a one-to-one approach to measures and evaluation. So let's say, for example, we have 17 elements in a bundle. You will not receive 17 measures for a bundle. You are likely to receive no more than 7 or 8. So, and the rationale for this is we want to limit the burden of collection. Now, that limit will come so you can be able to do the work and be able to implement more than looking for strategies to collect the data. Now, there are more data options that we talk about in terms of looking at the global picture of how we can be able to obtain both qualitative and quantitative data to inform the work. Now, processes is what you're doing. Now, how you're doing it in terms of implementation. Do you have an up-to-date guidelines on, let's say, risk assessment, for example, behavioral risk assessment? What is your approach? Do you use the PHQ-9? Do you use the Edinburgh criteria or Edinburgh protocol? So each and every one of these is to be able to understand what you're doing, and not just us. And when I mean we, I'm not talking about us as MCCI National. I think it's more important for your own collaborative members to be able to understand what you do and how effective it is. So in case there is any organization within your collaborative that has some limitations in this regard, you can be able to support. So it's the community aspect is why we see these process and structure as very critical in the short and intermediate term of our implementation strategies. So again, this is the interaction you have in your local maternal safety work group, the investigation and the counseling and different approaches that is taken, even care coordination, for example, which is a big piece of the postpartum bundle, is a very critical aspect of how or in the processes that you take. Now, finally, outcome measures. We look at morbidity, and you will see me skim through mortality very quickly because I don't like talking about it. We focus on morbidity, and of course, the reason why we focus on morbidity is we believe this is the area in which we can be able to have an impact. Now, based on these evidence-based recommendations, you and your community, based on that, your ability to be able to see some of these warning signs early and take necessary actions to mitigate these presentations, you'll be able to mitigate mortality. So that is why we approach, we collect morbidity data and non-mortality data. Now, we believe we can be able to work with each and every one of our pilot sites and our national partners, such as the CDC and HESA, and be able to obtain mortality data. Now, given the very small number of N compared to other clinical presentations or even mortality from other presentations, we believe this is feasible. We believe this is actionable, or our approach is actionable. Therefore, morbidity will provide us a much better picture of what's going on in the community, and we can be able to support your implementation strategies to implementing the MCCI bundles. Next slide, please. So again, we hope that as we implement bundles, it is a continuous process. And we just don't hope, we actively engage in this process. We want each and every member of the local maternal safety work group to have data that is actionable. What do I mean by data that is actionable? We want to be able to see, well, within this quarter, for example, what is your rate of behavioral risk assessment for women and birthing persons? Now, one thing I also want to emphasize is that we have a couple of measures, I'll say maybe 10 measures for the postpartum bundle. We do not expect the measures to be applicable across the board for each and every organization, because the nature of, let's say, the MCCI framework necessitates providers of different types of services, direct and indirect care providers. Therefore, some of the elements or measures will not apply to you as an institution or an organization. Therefore, it only allows us to be able to see a global picture. Therefore, if you provide data from breastfeeding, for example, if that is the type of services you provide, another provider provides that information based on risk assessment, for example. We hope these pieces of information will provide a global picture. Therefore, you as the collaborative members will come into a data portal that looks like this, and you'll be able to understand what the dynamic is within your community. Now, one of the things that we usually get from evaluators is that, well, what about double counting? Yes, we do understand there is likely to be double counting because individuals may meet the criteria, let's say, for example, for Healthy Start, and they will still meet the criteria for WIC, for example. So there may be double counting. But one thing that we want to emphasize is that this is a quality improvement program, not research. Now, can we utilize the data for research? Sure. But the idea is that no matter how much we have those intersectionalities or even crossovers, it will still give us a good picture of what's going on within the community based on evidence and based on research. Several research have shown that some of these intersections is not significant, and we can be able to navigate around that crossover. So again, you'll be able to see based on your community. So here where you see the map will be a map of your own community, meaning if this is Tulsa, Oklahoma, it will be a map of Tulsa based on the individual organizations that are part of the collaborative. Now, then overview of element implementation will be based on the data that you provided us on process and structure, on how many elements your collaborative have implemented, how many elements organization A is actively implementing, how many elements is organization B is behind on, and when do they think they can be able to get up to date on implementation. So structure measures are something like, do you have an up-to-date, let's say, have you recently reviewed your behavioral risk assessment protocol, for example? Is it a yes? If it's a no, how old is it? If it's how old is it, and do you plan on reviewing it? And then we have the text data that we want to take in terms of qualitative data to support implementation or to provide the pilot site or even just local maternal safety work group and overview. Now, again, so that applies to each and every one of the measures you'll be able to see. You will also be able to see the outcome measures, which is severe maternal morbidity, based on the AIM, the ACOG AIM criteria, as well as the CDC. Now, in terms of those collection, we are still open to collecting, let's say, the Joint Commission definition, which is slightly different from how the CDC classifies severe maternal morbidity with the elimination of some transfusion codes. But again, it is still valuable. It still tells us the same information. It gives us an overview. Based on our own research, there's no statistically significant difference between those two collection strategies. Next slide, please. So I'm going to stop here. And if you have any questions, we'll be more than happy to answer them later on after. I'll turn it over back to Karen. Thank you.
Thanks, Sonny. So you see, while Dr. Sully explained that beautifully, and you would not want me to talk about data and process and structure measures as he can. So thank you for that. We are going to take you on just a quick glance of the application. And let me just say, the bulk of this application, what we're looking for is a rich description of your community and your community's collective capacity to implement AIM-CCI, right? So we want to learn who your community is, you know, why you think this is necessary to bring to your community, what challenges are you dealing with, to articulate, what those social and health challenges are, and your efforts to demonstrate how have you been able to demonstrate a commitment to equity, and that it will, carry on throughout this, your implementation of AIM-CCI. So it's a very brief application that we're looking for. It's a narrative with some letters of commitment from your partners at the community level. And I am going to ask Amber to then take us into the application, just so you can see from our website how you get from the website to the actual application, because at the end of it is a button to submit directly into our portal. So this is on our website. And when you're on the site to bring this innovation to your community, there's a little hyperlink there where you can get to the application. It's going to give you all of the background information and overview. A lot of the content that we talked about today is contained in this PDF. And if you received this invitation to join today's webinar via email, it likely came with this PDF document. If anybody from today's call, you don't have it, or you are having trouble finding it on the website, please just let us know after this, and we are happy to send it directly to your inbox. When there's several hyperlinks also embedded throughout the application that will take you to more detailed content, again, about a lot of the things that we've talked about today, from the website, from looking at our bundles, looking at the CCI roadmap, and some of the other resources. When you get to the required pieces of the application, which is toward the end of that document, it's going to walk you through just what we want to see in the narrative, what we're asking you to explain or describe to us about your community, and the partners that you're going to bring to the table to implement AIM-CCI, because remember, this is done in a collective impact framework. So we're looking for a lead organization that is going to act as the main point of contact for your community, that will be our contractual partner, but also that you have the ability to bring other partners with you around the table to address this very complex issue at the community level. On the very last page of the application, there's another hyperlink that says, click here to submit. So the PDF gives you all of the content of what we're looking for. And then when you're ready to submit, you click that button. It gives you that information again, but this is actually where that information goes into our portal. So you just complete this form. Again, it's the same narrative information. We're going to give you text boxes just to fill that in. If you want to prepare something on a Word document and then plop it into, cut and paste it and put it in this narrative form, that's perfectly fine. You can free type into it, and it's just going to take you through every piece of what's described in the application PDF. The very last thing you're going to do is actually upload your letters of commitment. So and I think it's described in there, the letter should be really specific as to why each of your partners that you're submitting a letter for is engaged in this process. So I would highly encourage you not to have a form standard letter, but let your partners write to you to identify what their role in the process is going to be, how they see themselves as part of the solution for your community. And then it has to be signed. So your letters of commitment have to be signed by that organization's leader. So you can upload those files. You just select the files from your computer, upload them. You can save, or you can just press that submit button and it'll come straight to us. So that's it. Pretty short and sweet, I think, application process. So, what then? What are the next steps if you are interested in exploring this with your community? We would like your application by December 15th, and that's the application that we just walked through. We're then, as we receive and you don't have to wait until the 15th. You have your information together, you have your partners identified, you have letters of commitment. You can send us your application tomorrow. We will review applications as they come in, and we will make selections. In the interim, as we review and before we make selections, we may contact you, right? If there's anything that we have questions about, we may set up a call to say, talk us through, this piece of your application, but we will do a thorough review and make selections by January. We will reach out to those lead organizations to then finalize their contract and work plan and budget. And then we'll start working with you to implement AIM-CCI in your community. And as the national team, you will have access to us as much as you need to provide technical assistance, to have that ongoing continuous communication with you on, bringing this approach to your community. We are here for you. We will have a very complete kind of orientation packet with a lot of resources that we've already developed in partnership with our pilot sites over this time that helps to make this implementation, we think, very smooth, from coordinating your meetings to looking at the elements in a bundle to getting feedback from your partners. So we will make all of that available to anyone who comes on as an implementation partner. And with that, I do recognize we are a little bit over time, and I was trying to look at the chat earlier. I did not see any questions, but for anyone that wants to stay on, if there are any questions, we are happy to do our best to answer those right now. We will put together an FAQ that will go out with this recording as well. So what type of funding is available to new sites? And that's from Peggy. So Peggy, and it's included in the application, new sites will get $22,000 to implement this effort to work with us over the course of the year in 2023. How would this work concurrently with PQCs who are implementing the 4th trimester bundle? And that's from Stephanie. Stephanie, I think that's a very nuanced question for PQCs. And I think that because AIM-CCI is intended to work, across the community collaborative model, we'd probably have to work with any group that's also working in a PQC framework to see how these two efforts can be complementary. But I'm going to defer also to other members of the team that are on the call today if anyone wants to add anything to that specifically for Stephanie. But I think that's a pretty, that we'd probably have to think through that with you a little bit. Sani, any thoughts on that, on the PQCs?
No, I think definitely there is a lot of, I think, intersections between the 4th trimester and the bundles. And I think in a recent conversation we had with the specific regions PQC leadership, we emphasized the kind of connections that exist between the bundle as well as some of the opportunities for collaboration. Now, the structure of AIM-CCI is in such a way that, as Karen mentioned, it has to revolve around the community dynamics, because a lot of the bundles are local in terms of the elements implementation. But I definitely think the PQC definitely has a role, and that, let's say, for example, within the org chart or even the conceptual framework for AIM-CCI, the PQC has a role in terms of playing a critical role in supporting the kind of work that AIM-CCI does. And some of the elements as definitely locally, will support the 4th trimester work that is being done by the PQC.
A cap for the number of elements, not elements. We talk about caps on the number of elements all the time. No, a cap on the number of applicants. Yeah, we're going to enroll up to 19 new implementation partners. So our agreement with HRSA calls for us to be in 25 states by the end of the project, and we're in 6 currently with our pilot sites. Okay, well, don't be shy. Please reach out if I can make this slide go to the next one. Stay in touch. If there are any questions that come up after this, don't hesitate to contact us. You can reach us at aimcci@nationalhealthystart.org. Or you can contact anybody from the team that's on this call. There is no wrong door to contacting AIM-CCI. We will definitely, be in touch with anybody that reaches out. And again, we will make this information available to you again, along with an FAQ. So we appreciate your time this afternoon. We're very excited about this milestone in the evolution of AIM-CCI to be able to bring it to new communities across the nation. And we hope that, among all of you today, that we will be working with you in the near future. So thank you so much. We appreciate your interest, and we will be in touch. Thank you.